Welcome to Health City Talks. In this edition, we're going to follow up on the discussion in our last episode about the Citizen Care Pod and learn a little bit more about the technology that is involved and also get a sense of where this is all going and what the future might hold for the company and for the applications that the pods can be used for. Once again, my name is Mack. I'm the co-founder of Taproot Publishing. We publish the Health Innovation Roundup sponsored by Health City every Wednesday morning here in Edmonton. It's a newsletter that brings together everything that's happening in the vibrant health innovation sector in Edmonton. And I'm happy to be moderating this discussion again. And joining us today, we have Carl Demarco, who is the CEO and co-founder of Citizen Care Pods. Welcome, Carl.
Thank you.
And Mike Anderson, who is the CEO of ConnectUS Global, a big strategic tech partner and testing partner on the Citizen Care Pod. So welcome, Mike.
Thank you, and thank you for having me.
And of course, we've got Antonio Bruni from Health City joining us as well. Hi again, Antonio.
Good afternoon, Mac, and Carl and Mike. Thanks for joining us.
Thanks for having us.
So in the first part, Carl, we spoke with your colleague Zenon about where the idea came from and what it is and what it might look like in the future. But I wanted to follow up on that and just get a little bit more detail from your point of view. Obviously, there's some real challenges that we've faced and are facing through the pandemic that the pod, Citizen Care Pod, can help solve. But there's a business opportunity, right, as well. So can you maybe expand a bit on where you think the company might be going with this technology?
Yeah, there's a business opportunity, but when I went into this originally, it wasn't so much about making money.
Yeah.
It was important for me to give back to the community because I was seeing so many people being devastated, losing their jobs, companies being shut down, etc. And this initiative was a way to help the industries that's been affected and people to get back to work and to get back to in a safe environment. And also the whole purpose of this was to create safe testing and to save lives. And so that was our original motive. If you asked me a year ago if I was going to be in this business and the world was going to be in this, pandemic situation, I'm originally from the entertainment business, as you know, and I would have said, yeah, that's a great movie script, right? So right. How everything started evolving with the Citizen Care Pods, it's really been evolving now to, creating these COVID safe zones, which we call it, Citizen Care Pods Safe Island. Right, and it's creating a bubble similar to what the NHL did and what the NBA did, and NHL do in Toronto and in Edmonton, creating a safe bubble for the hockey players to play games, and same thing with the NBA in Orlando. But we will do that for key industries. If it's a safe bubble regarding an airline flight or an airport or a restaurant or a hotel, or a trade or exhibition or a live event concert or a festival or a workplace. And so we have been evolving where it's more than just the pods, which are incredibly designed. And I give Zen and my partner the credit on that. But to make sure that it's a combination of multiple different layers to create this, safe zone environment for COVID, where it's the blockchain platform, and we'll get into that a little bit more.
Yes.
The contact tracing and monitoring, these are all going to be critical in the future of where this industry is going. And I got to tell you, what we've put together with our coalition group with PCL and WZMH and ConnectUS and Honeywell, etc. There's nobody on the planet, and we're very proud that we're Canadians, that have put this complete turnkey solution. And we have been sought after, or having meetings online with the video chats like this globally every day, morning to night, 7 days a week.
Yeah.
And so it's really incredible where the future of this is going.
Yeah, it's very exciting. I've seen a number of other examples of mobile test sites set up using CCANs or intermodal containers, but nothing that, as you say, seems as all-encompassing, as well-rounded with as many different layers as what Citizen Care Pod has done. Do you see that as the big, unique differentiator between what you're doing and maybe what some others have tried to do?
I think the uniqueness here is the team and the complete package. It's
right.
More than just a sea container being turned into a medical portable testing center, which, by the way, can be used for deploying vaccines,
sure.
Doing flu testing, etc. But it's all the technology that's driving this and where we're going with that. And that is the future here. So for an example, imagine having a citizen care app powered by our friends at ConnectUS, Mike Anderson, where you can go on there, you can basically book your appointments to the location, you put in your name, your info there, etc., your doctor info, question and answers. You get a Q code, and then what happens, you show up to the testing, your bar scan your code, your profile pops up, you do your test, and you're out of there, and you manage to get delivered on your app in a safe, private manner.
Right.
And Michael can talk a little bit about that. He's the expert on that area. And it'll give you a red or green citizen care digital certificate. Green mean you're negative, red mean you're positive, which then you should be quarantined. It will connect you into the proper health authorities for contact tracing and give you advice how to deal with things. And green, saying your next test should be so many X days. And what happens is that because it's on your app, the system, the platform, the blockchain is interconnected and can be interconnected to an airline, to the reservation system, to the airport security area, to custom immigrations, to a place of work where you swipe in your badge to get in the doors in there, to a concert venue.
Yeah.
So any type of those, to a festival venue, any of those type of scenarios, or an exhibition trade show, our systems is easily to be adaptable to deliver those testing results. And so therefore, if you don't got a green digital certificate, you ain't going in, right?
Yeah.
And it's creating that safe zone that we talked about, which is the citizen care, safe island, safe zones.
Okay, so it sounds like there's a lot of tech to make that happen. So Mike, I want to bring you into this. Maybe you can talk us through a little bit about what ConnectUS has brought to Citizen Care Pod, and how does the tech work inside these pods, these safe islands, as Carl calls them?
Certainly. So really, the ConnectUS core functionality or core company mantra is around geospatial intelligence. So our traditional business, pre-COVID, 2019, 2020, was around tracking and monitoring oil and gas workers for safety and lone worker situations in hazardous atmospheres. So when we looked at the pandemic around risk association and essentially, this layer of testing and layer of declarations and waivers has really introduced an entire new administrative burden on people that want to perform their own governance strategies around the pandemic. So we took our core business focus of understanding risk in a hazardous atmosphere with our real-time location system, and then started to extend the boundaries. So we're no longer monitoring people for health and safety within the plant. We're now extending that all the way to the person's home. And before this, we say we were doing contact tracing before it was cool, but essentially contact tracing within the oil and gas space was all around understanding risk parameters between two entities, usually an operating machine and a person. So when we look at this problem that we're all facing globally, it's around understanding that risk threshold. So the technology that we put into the Citizen Care Pod was our real-time location system to do the contact tracing. An example here, light goes on, tells you if you're safe, and then taking that onto the Corda blockchain so that all of the different data augmentation steps around doing declarations, waivers, consent for collections, booking your testing time, facilitating the test, that all of those different data centers are published on the ledger in a private encrypted atmosphere and then distributed to all of those other federated parties seamlessly without ever having to pick up your pen. So it wasn't a large stretch for us to put together the technology solution, but really repurposing our leading edge technology to solve this problem within the pod.
Can you just go back to blockchain for a minute? Both of you guys have mentioned blockchain there. And I imagine for at least some of the people watching this, they're thinking, Bitcoin? What does Bitcoin have to do with this? Can you just maybe explain how does the blockchain part fit into the tech that you've brought to Citizen Care Pod?
Certainly. So the blockchain, if I put that in two different spectrums, one is on, you need to be based in a methodology of how you're transacting that information. So we partnered with a company out of Calgary, again, Canada-based company called Guild One. They are the global leader in industrial blockchain solutions for Amazon. So what we partnered with them to do was really, they set their framework around doing royalty transactions for oil and gas facilities. So they were doing similar transactions on smart contracts, but with massive amounts of data around royalties and production facilities, when we looked at this, we said, okay, I have a person with my own personal profile and I want to share my information with a ton of different parties seamlessly. That blockchain transaction was right in between their wheelhouse. So we're providing the layer with ConnectUS of all of the edge devices, technology user interface, all those pieces. And then the network that sits behind it, the 1D network, which is supplied by Guild 1, is really providing all of those different endpoint destinations over a smart contract. So we don't have to do an integration with every single party. So the overall total cost of ownership or operation of the system is very low, and using the same methodology that financial institution uses for Bitcoin and things like that, we're using it for personal information around health, so that not one person can uncrypt my information without that public key. So I could send out my information wide to the internet, but unless they have that unique identifier that is personal to my health data, they could never see any of my data. So the Corda blockchain gives us security, privacy, NIST compliance, as well as being incredibly globally scalable, because it doesn't matter what region you're operating in, the blockchain works on the same contractual methodology as it would between a personal transaction with your bank account.
So for the end user here, the real benefit is that trust, that security, that their information is safe and is being transmitted safely, and that their privacy is being protected. That's important. I think that makes sense.
Yeah,
Antonio, did you want to jump in?
Yeah, I think, this is a primary example just to what Mike has demonstrated and shared, that we're seeing innovations that are being applied in other sectors that have been developed in Canada, now being deployed in the health sector. And I think that that's such an important and crucial piece to this, is that we have the strengths, we have the capabilities within our country to take the technologies from one sector and find novel applications, such as those in health in response to the pandemic. So I think this is such an important piece to the whole economic development and diversification conversation that we're often hearing about, not just within the province of Alberta, but across the country as well.
Mike, sorry, did you have something else you wanted to add there?
Yeah, I think the only other piece that's really important as part of that blockchain is that, if I have a profile on a regular application and it's transmitting over the network, I have no auditable record of how that data is being interacted with. With the blockchain, because the person is always in control of their personal data, and we use Apple Wallet, Android Wallet, things like that to always have this record, is that you have an auditable, compliant record. Somebody can't query your data without your permission, without your physical permission of flipping that QR code or hashed encrypted token to them. So it really takes an additional level of support and protection around your privacy information, and you're never federating any of that outside of your control. So if I want to share my data with somebody and I want to check to make sure it was transacted, transmitted, anything like that, I have a record of that transaction that I personally can view, and I don't have to be a coder or a tech wizard or anything to be able to view that. So I think that's important when we talk about informed consent around privacy.
So I'm sensing there might be a connection here between the technology that you've been describing and what you were talking about, Antonio, with the economic diversification angle in here. So maybe Carl, back to you. We heard that the Citizen Care Pod is in a few different places in the US. Can you talk a little bit about where the applications are currently, and maybe some of the challenges and opportunities with this Canadian made in Canada solution, solving these similar problems in other places?
So we're seeing opportunities, let alone US, let me talk about it on a global basis.
Sure.
We're seeing opportunities, for example, in Latin America and Chile and Colombia in the oil mining field, where some of these companies have to test, 10,000 employees on a weekly basis to make sure that they don't have any COVID outbreaks. We're seeing a huge opportunity in the, if you want to call it the travel tourism industry, the conference convention business, where they've been devastated. Yeah. You'll be seeing some big announcements on our side there on a global basis very shortly. We see many opportunities coming out of Las Vegas. Mike was just down there right now for Recovery Expo 2020, and the feedback that we received was incredible. The industry has been really down and out in its luck, and they were looking at ways, how do they get back in business? And when we showed them the solution, I give credit to Mike and his team, the light bulb went off with everybody. And so we think there's going to be big opportunities also for the entertainment venues down there, the casinos down there, the conference trade, convention business. But also we see huge opportunities with airports and airlines. So for example, you book your flight, you get in you'll then be connected into the Citizen Care app powered by ConnectUS. You book your appointments, get tested, you get a green digital certificate. It's tied into the airline system and the security system, and allows you a fast track system through the airport to catch your flight. And hopefully it'll be everybody on that flight would have been tested, and you're feeling confident to fly. Because right now we've been seeing research and feedback from the public that I think it was like 73 or 75% of them are very worried to start going back to travel and to conference and conventions until it's safe. Yeah. And so hence the safe zones that we're creating with the Citizen Care Pod Safe Island with ConnectUS, creating an opportunity to make them feel comfortable and to go back into a safe environment here to start conducting business again. And so that is going to be the future where we're going. And we see the same thing with festivals, live events, because all these industries are out of business. The other area too is, like, for example, in Toronto, the GTA, we're seeing a shutdown of a lot of the restaurants.
Right.
Well, if you imagine if you have a bunch of these pods strategically placed throughout the city, the employees of the restaurants get tested. And then if you're a patron, you get tested, you get a green digital certificate on your phone, and now you go to a Citizen Care Safe Island restaurant where nobody in there has been tested positive, and you can have a meal with your family, and the employees feel comfortable. So there's going to be a lot of these type of examples to help that industry get back to work, because they've been decimated also. And so we think our complete turnkey solution is going to help all these different industries to get back on their feet. And then the other thing too that we're finding there's an opportunity, and look, I'm not a health industry expert, right? But I'm becoming one pretty quickly. It was amazing to me how a lot of the health systems globally have not been updated technology-wise.
Oh, fax machines reign supreme, right?
Yeah, well, you know what? I won't mention particular, ministries of health that are still faxing test results to each other, but that's what's happening. That's what they're dealing with. And so I think COVID now has reopened up the focus of investing back in the healthcare sector to modernize, to bring the technology up to speed. And we think we could play a big part of that. So for example, you go get tested at a provincial government testing tents, which by the way, I don't think it's the right thing to do, is test out of tents, because unless they're HEPA filtered, negative pressure, air conditioning, heating systems in there, you should not go in there, because COVID's airborne. CDC out of Atlanta has made that very clear in all their research. But right now, what do you have to do? You have to fill up all these paperwork.
Yeah.
That takes 10, 15 minutes. Then you got to go in. And by the way, who's really going to read that paperwork?
Test them, move on.
Yeah. So it's so manual process, and that is a big problem. And we will provide, and we have the solution to get rid of all that and to modernize it and make sure in a safe way. And I think we can provide a support of help growing that whole technical side of things for the healthcare system out there for the different governments around the world.
I think you're right that there's a big desire now and a big interest to reinvest a little bit and to modernize those things. It sounds a little like what you described to me as maybe analogous to TSA pre-check in some cases, this system that's been set up to help you quickly get approved and to move through and to then go onto a safe location. Obviously a little bit of a different application. I think the one about restaurants and a Citizen Care pod outside a group of restaurants is fascinating. That's a really interesting idea. But do you think, just moving this conversation now a little bit to future of testing, do you think this is here to stay? Because we've had previous pandemics and outbreaks. There was SARS and H1N1 and things happened there, obviously, and we started to see hand sanitizer all over the place, but things pretty much went back to normal to the point that, when COVID happened, and organizations had to come up with these disaster response plans, they'd forgotten everything that happened, even just with H1N1. So maybe I'll start with you, Mike. Do you see, and what have you seen down in Vegas? Do you see this as a long-term thing? This is going to be here forever now, or is this just, until vaccines are widely applied for COVID?
Well, I think the coronavirus is going to be part of when we talk about new normal, I think it's less about the tag, the coronavirus, and more about the ultimate community health and populace health. Like, we've learned very, very quickly that our public health facilities are not set up to handle these massive influxes of sick people. We're assuming that people are going to be moderately unhealthy all the time. But unfortunately, what this has shown us is that we need to better understand the overall health of our population to be able to handle these pandemics, so they're not, when this thing first started and we were talking about high-risk people, it was aged care facilities. And then it's about people with autoimmune diseases and they're compromised. So we need to look at them too. Like, our understanding of the populace of health is, and I say it often, is no news is good news, right? Like, if I wake up in the morning and I'm not achy or coughing, I'm probably good. But the opportunity to use this pandemic as a foothold to increase our understanding about public health is, I think that this is going to be around for a very long time, because I think that the world is starting to understand more that we need to get a better grip on our healthcare systems and really support these healthcare systems with these digital adoption strategies, so that when something like this happens, it's always going to be shocking in how a pandemic comes across, but is that it's not as big as a shock to the system, because we have base level infrastructure in place to be able to triage quickly, diagnose quickly, and ultimately support quickly any resurgence of any pandemics in the future. So I think that this is going to be around for a while. I know I attended the session last week in Vegas, and one of the board members from the MGM group, John Flynn, he spoke about that this is a 5-year to 10-year kind of resurgence, that we are going to see initial level of infrastructure come in. We're going to see another level of inoculation and vaccination come out. But then after that, we're going to be left with a ton of data and a ton of infrastructure that we need to be smart to be able to support these systems moving forward. That you said it'll come out of pandemic response and into public health preparedness.
Matt, I agree with Mike on this. And for example, look at Toronto, which is my backyard.
Yeah.
The downtown core was the economic engine pretty much for the country, right? All the financial institutions there, et cetera. You can right now shoot a cannon through downtown Toronto. Nobody's going down there to work. All those big office towers, 70, 80 stories tall, are all sitting empty. Why? The employees don't want to travel on the public transit system. Potential COVID being spread, and they're working from home. There's a fundamental change of people working from home that I don't think it's going to be an elastic band effect where everybody's going to be rushing to go back to work. I think you're going to see a good significant part of the population work out of their home, work in the suburbs versus downtown. Now, we've been getting feedback from major real estate property owners that they want to start any employee going into their buildings, not just for COVID, but testing for flu. Flu has not gone away. Yeah. And so they want to create these free, zones that, nobody is spreading, one person got the flu, he gives it to 10 other people, no different from the COVID situation. And so for these buildings to survive, they're going to have to take future actions to put these measures in their buildings to encourage these employees. It's safe to come back to work. But I don't think you'll see 100% of that going back to the old ways. I think that those days are gone. And, I think there's always going to be a new COVID coming around the corner. And I think that's just, I think time will tell that. But for an example right now, I think COVID itself is going to be at least 3+ years, because the time, if a vaccine comes available, the time it gets manufactured, the time it gets distributed, and the other thing is, we've seen some stats and research, the 70+% of the population don't want to be the first ones taking the vaccines because it's rushed. The clinical trials have been rushed. You don't know what the real side effects are. And I think a lot of people are going to wait a couple of years before they're going to rush to start taking the vaccines. They rather have somebody else be I hate to use the word guinea pig, but that's what I think it's going to
Somebody else
happen.
to go first. Yeah. Antonio, you've got a lot of experience in this industry, so I'm curious if you think there's any particular factors about now that make it more likely that these things will stick, as Carl and Mike have described. Like, for instance, to me, I'm thinking we didn't have blockchain probably the last time the pandemic came about, and so that technology and its application for privacy wasn't a thing. Is that right, do you think? Are there other things that are different about this time?
I certainly think that the pandemic has put a spotlight on technologies that either existed in other sectors or have been born in other sectors and are starting to come through. And I think what COVID has done has been a great test bed for validating the necessity of these solutions like blockchain. And we see this with virtual care platforms, where prior to the pandemic, where people could leverage these technologies, there was not such a huge consumption of them. And now the pandemic has essentially accelerated their adoption into care because individuals had to be isolated. They couldn't go to see their family physician. So out of this crisis was born the opportunity for virtual care to be commonplace and to for the healthcare systems to respond to it. And I think we're going to see that as the pandemic continues to move forward, that the pivoting of innovations that exist either in other sectors or the development of new innovations that are explicit to health are going to be leveraged. And COVID is just providing that opportunity to test their necessity, validate them, and hopefully allow them to expand more broadly into commonplace.
Yeah, I think that's interesting, sort of that opportunity and that acceleration of some things that might have already been, happening at some point, but not nearly as quickly as they have now. I want to sort of close this conversation in a few minutes here by talking a little bit more about the future. I know it's very difficult to think about where things are going and what might happen. You both, or all three of you, I'm sure, have been talking to lots of folks and gaining lots of perspective on this. I think, Carl, first, I'm curious to know if you enjoy this newfound career you've got leading Citizen Care Pod, or if you'll be happy to go back to the entertainment business.
Back to the wrestling business.
Yeah.
Look, I invest in all different type of companies. I invest in people and management. I typically won't invest into a startup per se. I usually like to see a company generating cash flow, etc., and with a good business plan. And I threw all those rules out the window on this deal, and I laugh about it because how we got involved in this, we didn't have a chance to write the business plan. We just went in there and we started going fast, and we hit the ground pretty quickly. But I am enjoying it. I'm hoping that we're going to make an impact of people's lives, both financially, putting them back to work and taking care of their families and putting food on the family's table, but also saving lives. And even the initiative that was done in Manitoba with the Citizen Care Visitation Center, it's important that when you got an elderly person or a senior citizen who is sick, you got to have family around you, and for that whole development, what we did there, it's and I give credit to the Manitoba government. They really became first in the world to do that. I give really credit to those guys taking that initiative, but it's made a big difference and those families' lives. And I think other governments like Ontario, BC, and around the world, they ought to be looking at what Manitoba did, because they need it for hospitals, they need it for nursing homes, they need it for long-term care homes. And so I'm excited to see all these things. And every day that we go on, I'm seeing more and more opportunities. And the word of mouth about our company has gone global. Yeah. I'm getting calls and emails daily around the planet. It's just incredible. So I think we've hit something here incredible to make a difference in everybody's lives.
And it must feel really good to get to work on something, as you say, that can save lives, that can have a real meaningful impact on people's lives. So that's got to be motivating as well. Mike, just over to you quickly. Is there what does the future hold for ConnectUS, and what sorts of opportunities are you seeing now coming out of Citizen Care Pod and your collaboration and the work that you're doing on the tech side of things?
Yeah, so our main focus really about driving that experience, that health passport experience. So elevating the conversation from just focusing on the test or the pod or the pandemic itself. Our real mission and goal is to support that environmental safety and governance strategy within companies and provide them the data that they need to build their governance strategies, but also to support and promote that employee health space. So we live in the oil and gas space, but frequent in others. And on top of that, to be able to support these large multinational companies in their resurgence and their strategies moving forward is really our passion, and we'll continue to support them moving forward.
Matt, I want to toot a horn for Mike here for a sec, because he's very humble.
Yeah.
But the question you need to ask Mike is how he got into this area that he's in right now, what life-changing experience he had in Australia that wanted him to turn around his life and make a difference and make sure that, you know, what he experienced didn't happen to other people. And so, Mike, you got to tell that story, because I just heard this the other day and I was completely blown away. And I give kudos to Mike. He's really an incredible individual. So I please ask you, Mike, please tell that story. I think it's very motivating.
If you're willing, Mike, we'd love to hear it. If not,
you don't,
that's totally fine.
No, it's you know, it's a personal story, but unfortunately my introduction to technology was built off tragedy. So I was I came up off the tools in my career. So I'm a triple ticketed tradesman, a steam fitter, pipe fitter, a boilermaker, and a B pressure welder. So I was working in Australia in an underground mine, and, you know, working away. And I don't know your familiarity with underground mining terminology, but I was working on a long wall, which has got a steel drum about 2 meters long and about 800 picks on it, and it rotates and it shaves the coal off the seam. On the other side of the wall, there's roof support. So I was working on the roof supports, and my friend Gary was working on the shears. So I was working away. It's very loud, steam and everything's flying, and I heard what sounded like somebody threw a handful of change against a steel wall. So very loud, clangy kind of experience. And I turned around just to hear Gary have a quick shout, and then saw his boots go over top of the drum, and that put his body through an 1.5 inch crack in real time. So what happened after? Of course, I was the first one on the scene. I had to isolate the equipment and safe everything out. But I got together with some of the developers at P&H MindPro at the time, and we developed a RFID chip that gets sewn into the person's coveralls. And then we put a proximity sensor on the drum. So now when somebody walks up to it, it shuts off. So I say it tongue in cheek that we were doing contact tracing before it was cool, but essentially the use case from that really showed me what the benefits of that technology is. And now, you know, selling it globally and supporting that is really, for me, I'm very passionate about it because I've went through that experience, and being part of a fatality always changes your life. But essentially, understanding proximity risk and things like that, it's transmission across the board, whether it's rotating equipment, industrial, health and safety. So that's how I got into the game.
Well, thank you for sharing that story. It's incredible to hear that you've been able to take tragedy like that and turn it into something that can have a real positive impact on people's lives around the world. So good on you for doing that. And yeah, thank you for sharing that story. Okay, guys, we're out of time for this Health City Talks, but this has been great. It's super inspirational to get to talk to people that are doing such interesting work like both of you are. So thank you for sharing your experience and your story with us. That's Mike Anderson, the CEO of ConnectUS Global, Carl Demarco, CEO and co-founder of Citizen Care Pods Corp, and Antonio Bruni from Health City. Thanks all for joining us.
Thank you for having us.
You can find out more about Health City Talks and find future episodes on the Health City YouTube channel, or check out the Health City website for more. Thanks again, everybody, for tuning in.